So according to the Project 2025 Heritage Foundation, it says, quote, expensive and misguided government interventions in education are, whether intended or not, pushing young people away from getting married and starting families to the long-term detriment of American society. Reforms to reverse counterproductive government incentives could boost the married fertility rate significantly. And later it says, reducing federal higher education subsidies and loan cancellation that place the federal thumb on the scale in favor of spending years in post-secondary work of questionable value will help young Americans to start and expand their families. Literally saying right there, we need to stop helping people have higher education because having higher education means that they delay having children or don't have children at all. This is the Heritage Foundation's argument. And this is Trump carrying it out by canceling and making it more difficult for professions that are predominantly women to get loans. Also in that Heritage Foundation fact sheet proposal, they propose canceling outright the Grad Plus loan program, which that big, awful bill did. It canceled the Grad Plus loan program, fulfilling the promise of the Project 2025 and Heritage Foundation. And then this next step of choosing, because the Department of Education chose which professions were going to get the ability to have the higher loans or not, and choosing professions that are predominantly nurses. Take a listen to what the American Nursing Association representative had to say about this.
But this is the time where we need everyone to speak up with the voice to let people know that this is just, we're not going to stand for this and that we need this to change.
If not, the proposed changes take effect in July.
Trump's Department of Education tried to quietly make a change, but it has backfired. Public outcry across the country. The change has to do with declassifying nursing as a profession. Nursing and other occupations such as social work, physical therapy, predominantly female-based professions. The reason? Well, Project 2025 wrote in November of 2024 that there needed to be a change in federal subsidies, federal loan programs, specifically in order to boost the married birth rate. My name is Dina Doll with the MeidasTouch Network. Let's get into this. So, as we know, what happened with the one awful bill that was passed in Congress this summer? They put a cap. I mean, there were so many provisions to that bill that hurt working middle-class families, people just trying to get ahead. And one of the provisions was to put a cap on how much the federal government could help give loans to people trying to go to graduate school. They capped the amount for $200,000 for a lifetime loan, $50,000 a year for professional programs. And then for non-professional graduate programs, they capped it for $100,000 lifetime loan, $20,500 a year. The Department of Education then just recently classified what degrees could have the higher $200,000 lifetime limit or the $100,000 lifetime limit. They included in the higher lifetime limit degrees such as law, doctor, dentistry. And then with nursing, they didn't classify it as a professional degree. So now nurses can only have $20,500 of federal loans a year. If anybody knows anything about how much tuition costs, that is probably not enough. A vast majority of schools, maybe some schools you can still get a degree at that. Vast majority you cannot. So what they are doing is making it probably impossible for a lot of people who don't have that kind of savings, who maybe are trying to get a leg up and where their parents cannot help them with their graduate program. They often have to take out loans. I had to take out loans for my law school degree. I wouldn't have been able to go to law school if I couldn't have taken out a loan. And so now you have people who are trying to go into the nursing profession and now have this cap. If you had any question whether or not nursing was a profession, they have 2 professional associations that govern them. They have licenses. They have their own code of ethics that they have to follow in order to maintain that license, similar to a lawyer, similar to a doctor. And if you had any doubt of whether or not having more or less nurses might benefit you, certainly anybody who's ever been in a hospital realizes your primary point of contact is your nurse. And what happens at a hospital if they don't have enough nurses? They don't close down. They don't have less patients. They have more patients per nurses. And it has been proven time and again that the less patients per nurse, the better care each patient receives. Of course, because then the nurse has enough time to do her or his rounds, because frankly, there are men in this profession also, but they have more time to do the rounds. Each patient has better care. So the Heritage Foundation, trying to put their thumb on the scale and trying to get more babies, maybe killing more people in the process, people that are already born who need nurses to be able to check their blood pressure and their heart rate and give them the right meds and not have too many patients to be able to take their vitals enough. But that is the consequence of what will happen if you have not enough nurses being able to go into the profession, not enough people who want to seek this higher education, but maybe can't afford to, not enough loans to be able to afford it. You will just have not enough nurses. Fresh start, same system, banks win, you pay. Fees and calls piling up monthly unless you fight back. PDS Debt has already helped hundreds of thousands cut their debt and put money back in their pockets, not the banks. Whether you are struggling with credit cards, personal loans, or medical bills, PDS Debt has custom options to help you get out of debt. They go beyond the numbers to understand your unique financial situation and craft a personalized plan designed just for you. There's no minimum credit score required. They're here to help you save more, pay off your debt faster, and start putting money back where it belongs, in your pocket. PDS Debt is A+ rated by the Better Business Bureau, boasts thousands of 5-star reviews on Google, and holds a 5-star rating on Trustpilot. Why? Because PDS has helped hundreds of thousands of people get out of debt. If I had needed this product, it's what I'd use. Don't wait another month. Take back control in 30 seconds. Get your free personalized assessment and the best option for you at pdsdebt.com/mistrial. That's pdsdebt.com/mistrial. pdsdebt.com/mistrial. And let's talk about this idea, this attack on women working, because that is something that we've seen, of course, from Dobbs on the Heritage Foundation, from so many different angles, trying to keep the woman at home and having babies. Because it is true that the United States is having a declining birth rate, but we are a country that immigrants have always wanted to come to. So we do not worry about declining birth rate, population rate, in the same way as another country may. We're the country of opportunity and promise, and people want to come. So the same people who recognize that we have a declining birth rate are the same people trying to keep out those immigrants who could help increase our population. The idea is so white nationalist because they are afraid of having brown immigrants come to our country. They instead want to force the majority white population that exists to have more babies. And this is one way of them following through with that is to have the government make it harder for a woman, if she wants to do that, because they see mostly women in this, to be able to get that degree. And frankly, I have to say, I got my law degree and then I did stop at one point with my kids and stayed at home with my kids. And then look, I'm working again. So the Heritage Foundation maybe doesn't just want people to have babies and be able to have the choice to say. I actually think having a professional degree gave me more flexibility to be able to stay from home. I can't tell you the number of women I know who can actually work part-time or work from home because they've received a professional degree, which usually gives them a lot more flexibility than they have to work a minimum wage job where you're physically at the retail store. If anything, a higher degree gives more options to that woman to be able to decide when and how to stay home or not stay home. So is it just about having more children, or is it also just about keeping women away from higher education? Well, we have also seen them trying to take down any equity, female information from plaques and history, trying to erase us in so many different ways. But thankfully, in this situation, they tried to do it quietly, and they're not doing it quietly. There's a petition going around. The nurses are circulating a petition in order to try to get this change. As we know, when they try to make changes in the darkness, they are more likely to. But when you bring light to it, it makes it a whole lot harder. My name is Dina Doll with the MeidasTouch Network. If you have not yet subscribed to the MeidasTouch podcast, wherever you listen to podcasts, be sure to do that. And also be sure to check out the link to our sponsors below. Sponsor never censors what I have to say. And in this day and age, that is truly something I'm very grateful for.
Love this video? Support independent media and unlock exclusive content, ad-free videos, and custom emojis by becoming a paid member of our YouTube channel today. You can also gift memberships to others. Let's keep growing together.